Everyone, in this chapter, chapter 9, we're going to talk about risk assessment and risk estimation. This is actually, I love this topic. It's very interesting when thinking of risk assessment during the COVID-19 pandemic. And I want you to think about how interesting it was. When we hear about risk and we think about risk as we're going through this, think about how the older population, when COVID-19 came out, felt like they were at no risk at all. A lot of them didn't initially get vaccinated. They felt like they could go out. They weren't going to be told what to do. And we found out then eventually with time that they were at a very great risk of having complications from COVID-19. And then again, once we had more baseline information, we had the younger generation, the 20 and 20-year-olds staying home because they were afraid of their risk of getting COVID-19 or dying from it when actually they had very minimal risk. So just interesting to think about and how this was communicated to us. And I think the pandemic was difficult because it happened in real time, but I think we failed on pointing out who was actually at risk for the disease and what risks actually need to be accounted for. So anyway, epidemiological investigation, it not only gives us information about exposure and occurrence of disease or health condition, but it also can give us a risk that is related to the disease or health condition. And risk is the probability or likelihood that an individual will get the disease or the population that we're talking about. Risk analysis or science includes 4 parts. It's risk evaluation, risk communication, risk perception, and risk management. When we talk about risk factors, I'm sorry, there's a typo on there I just found. These are characteristics or events that are associated with the increased probability or likelihood of having an adverse health risk occurring. Some of these risks include biological risk, lifestyle, behavioral stressors, or environmental risk factors, and some are modifiable and some are not. And I thought this graphic showing the non-modifiable and modifiable risk from cardiac disease was a good example. When we talk about the prognosis of something, prognosis is a prediction of the future course of the disease. So when we look again at this graphic, the prognosis versus the diagnosis. The diagnosis in this particular graphic is the flu. The prognosis is what recovery you will have. So risk factors assess your risk of developing a disease, and the prognostic factors indicate the course of the disease that has already developed. And epidemiologists use this information to measure the prognosis of disease over time. So again, when COVID first came out, we did not necessarily know what the prognosis was, but the epidemiologists watched the outcomes over time and then were able to give people better information about their risk assessment and prognosis. Most risks assessments are quantitative in nature. It involves 4 steps of identifying the risk, the exposure assessment, the dose response assessment, and the characterization risk. Epidemiology sometimes use a risk matrix to show this visually. Visually. It is developed by identifying the population at risk, determining the risk criteria, assessing the risk, and prioritizing the risk. Risk matrix allow for decision-making around risk mitigation interventions. And here's just a little bit more information about risk versus prognosis. When we talk about risk analysis, this is the overall term for risk science, and there are the four components of this, and we're going to talk about each of those a little bit more. Risk analysis or assessment is an attempt to determine the risk factors and the magnitude of the risk that actually exist. Risk factors, again, are characteristics or events that are associated with an increased probability or likelihood of an adverse health event occurring. Common categories can be biological, lifestyle, stressor, or environmental. And again, they can also be modifiable or non-modifiable. And this is, I thought, a nice visual representation of how risks happen. You want to first identify the risk, then you're going to talk about the risk of exposure, then you're going to talk about the dose response assessment. So again, like that's what they used when they determined that we had to be 6 feet away from someone to avoid exposure to COVID, because the dose of the dose per se of the virus that you would be exposed to put you at the least risk of actually developing the disease. And then the risk characterizations happened over time. And if you look on page 109, figure 9.2, that gives you a good example to help further understand that. When we talk about human risk assessment, it utilizes the 4 risk steps that we had previously talked about. In humans, that determines the who, what, when, and where, what is the agent or hazard of concern, where it started, what are the routes of exposure, what is the pathological response to the exposure, what is the physiological response, how much do you actually have to be exposed to get the changes, and what is the minimum amount of time to cause toxic effects or signs and symptoms. So again, all these steps were used, and I think the people, I think as healthcare providers, we found it frustrating because this seemed to change daily. But understanding this helps a little bit more to know that these things changed over time. This was science and epidemiology in real life. And those of us who have a little bit of an understanding knew that this would change over time, but I think that was one of the things the general public found very frustrating. When we look at an ecological risk assessment, in addition to the human health risk assessment, the other things we want to talk about are are other living species impacted and where are they impacted? What is the ecological effect of the species that it has on the species, and what is the extent of the risk on the ecological life cycle, sorry. When we talk about workplace risk assessment, there are 5 things that we want to look at. We look at potential hazards. We want to determine who is at risk for harm and what is the root of the harm. We want to determine the level of risk and implement any necessary actions. We want to document any workplace risk assessments and outcomes. And if something does happen, like if someone gets a needle stick, you want to conduct a post-mortem or after the event risk assessment to determine how we could prevent those things from happening again. Risk communication can be challenging to communicate. It can be done in many different forms, verbally, written, or visually. It often occurs in high stress, high concern situations. And basically, what we are telling people with risk communication is about the potential hazard and the possible exposure to their person, property, or community. Risk management is what we do, is what's called when we determine how it is best to protect the public. So again, when COVID-19 came, people looked at the risk management and how they could stop people or minimize the risk of getting COVID-19. For example, they also determine levels of chemicals discharged into the water or substances that can be stored at hazardous waste sites. We're going to talk a little bit now about relative and attributable risk. Both are measures of the association between an exposure and the risk of developing an adverse health outcome. The relative risk, or sometimes you'll hear it called the risk ratio or the RR, that is the ratio of the incidence of the group with the exposure to the incidence of the group without the exposure. Relative risk provides information regarding the extent to which an individual with exposure may experience the actual health condition. And then it is important to know how to identify these numbers. So if the ratio is 1, there's an identical risk to get the disease among people who have been exposed and who have not been exposed. If the risk is greater than 1, there's an increased risk for the exposed when compared to the non-exposed group. And if it's less than 1, this indicates a decreased risk for the exposed group compared to the non-exposed group. When we talk about the attributable risk or the risk difference, that is the proportion of the incidence of the disease in the exposed that is associated with an exposure. And you can see those formulas there. When we talk about a risk ratio, we're looking at the ratio of the rate of the primary group of interest over the rate of the comparison group. And again, it's similar to the other ratio evaluations, but if our ratio is equal to 1, it's equal among groups. If it's greater than 1, there's an increased risk for the primary group of interest. And if it's less than 1, there's a decreased risk for the primary group of interest. When we look at odds ratios, this is generated from case-controlled studies, and it is a measure of association that quantifies the relationship between 2 exposure categories and a health or disease outcome. And you can find a nice example on table 1.9 in your book. Last but not least, we're going to talk about the integrated risk information system. This is basically where it supports the Environmental Protection Agency, or the EPA, mission to protect human and environmental health by identifying and characterizing health hazards of chemicals found in the environment. These are the people that set the values that determine if something is toxic to humans. So there's a certain amount of chemicals that may be allowed, but this is the group that determines what those levels are. It can also provide cancer descriptions for chemical agents, and there are also a few other risk estimators for cancer based on the specific environmental hazards that are found. So this concludes Chapter 9. Thank you.